It's the season for brand new mulch, and Brown's Tree Service has got your yard covered. Brown's Tree Service utilizes hardwood mulch that retains more moisture. Not only does mulch make your yard more appealing, it also reduces weeds, improves soil, and creates insulation for plants. Get the right mulch for your job at Brown's Tree Service. They shred it, haul it, and spread it in bulk. Or you can haul it yourself for the personal touch to your property. Call Brown's Tree Service at 785-379-9212 or visit online at brownstreeservicelc.com.
When someone has a passion for what they do, it comes through in the product they provide their customers. Just ask LaRocco's Pizza's new owner, Jason Johnson, about their crust. They make it every day and let it rise for a minimum of 24 hours before they use it for their pizza. And his staff doesn't want to do anything they won't be the best at, and you can taste it in their pizza. LaRocco's Pizza, just a half block north of the I-470 and Gage Boulevard exit. Come taste the difference.
It's time for Real Estate 101 with the Carrie Brown team from Preferred Advisors.
Good Saturday morning to you. This is Carrie Brown, Associate Broker with eXp Realty and the Preferred Advisors team, and you're listening to Real Estate 101. Today, I am here with Holly Cobb, Registered Nurse Practitioner at Oasis Family Medicine. Good morning. How are you, Holly?
Good morning, Carrie. Thanks so much for having me on. I am good.
I have been asking these guys to come on. We actually talked about it months ago. Holly is my doctor and my family and love her. So I thought, well, it would be great, especially with the way things are right now, to have Holly on as my co-host. I posted out for people to ask, what are they most nervous about? What would they like to know? So I've got some questions for you, if that's okay.
Yeah, I am happy to answer all the questions. Of course, there's always growing information on the coronavirus. There are, a little bit of knowns and a lot more unknowns. So I will, knowing that all the information is always changing, I'll give you the most up-to-date information that I know in that disclaimer. And also, if you don't mind, I'd like to add, I am so fortunate that I get to take care of you and your family with the family practice that we have. It is one of the blessings of it is that you get to know patients well and get to meet great people like you and your family. So we love having you here, and thanks for having me on today. It's an honor.
Well, I certainly appreciate it. So, first question off the bat, is it necessary to come home, wash your clothes, take a shower after being out in the public?
Yeah, it's a really, really good question. And obviously in a hospital setting, the answer is yes, you need to. At the clinic, do I change my clothes, change my shoes? Because this is a time we are all erring on the side of caution. If you are going into one of the essential services that remains open, it's a good idea to come home, leave your shoes definitely at the door, wash your hands, and if you feel like you were near somebody who was coughing or sneezing, absolutely go ahead and change your clothes as well. The 6-foot distance rule that we have that we're held accountable for when we're in public, it's with good hygiene. That is with people minding their P's and Q's and, not coughing, not sneezing. So if you happen to be in an environment where you are around that behavior and someone is coughing, I would go ahead and go home and take your shoes off, wash your hands, and go ahead and change your clothes. If not, just continued heightened hygiene.
So that actually leads into another question that someone posted. Is this airborne or is it surface-based?
So it can be both. It's air. It can be droplet based, sneezing, coughing, and then there is a number of studies that show the amount of time it lives on the surface, and they really range anywhere from hours to days, depending on the surface. So that shows, again, why we have the heightened awareness to this, why we're cleaning down surfaces, why you go into the grocery store and someone is washing down the handles on your grocery cart, or if no one is, you do it yourself, because at this time where we're trying to quarantine and try to beat this virus, taking those heightened measures is important because there's unknowns, and it's really dependent on the surface that you are touching.
So, another question they had is, can I get it or give it to my pets?
That is an interesting question. Right now, there is no evidence that pets can spread COVID-19. So no evidence. There is animals in general, they can be infected with coronavirus, and the fact that they would take that infection and spread it to people is extremely, extremely rare. So if you are petting your dog, I think a lot of our dogs are our therapy right now. I don't want to leave the cats out. A lot of our cats are therapy too. And it's great therapy right now with the increased stressors of our current situation. So hand hygiene applies to that as well. When you're petting and feeding and taking care of your dog, changing the litter box, doing that kind of stuff, then you want to do the best hand hygiene that you can as well. And that is recommended 20 seconds with soap and water. So warm water for 20 seconds. Or you might be using a alcohol-based product, and if you are, that alcohol-based hand sanitizer is recommended to be at least 60% alcohol. You want to cover all surfaces of your hands, and you want to rub them around until they feel dry.
The other one would be, is it necessary when we're out and about to wear a face mask?
If you are sick, you should wear a face mask when you are around other people because you don't want to spread your germs to them and increase their risk of getting sick in this time. Now, if you are sick and think that you have this virus, then I pose the question, why are you out in the first place? You should just be at home. So I have seen some face masks. There might be some people with some decreased immunity that are feeling well, that feel that extra line of protection. Again, if you are that worried that you need to wear a face mask, there is the question, why are you out at all? Because that does increase your risk during this heightened time of trying to stop the spread of the virus. So if you have to go to a doctor's office and you are sick, definitely recommend wearing a face mask.
And if you don't know, which I would imagine most people do, but you can order your groceries online and pull up, let them know that you're on your way. So you text them whenever you leave the house. When you arrive, say, I'm here. They bring out your groceries. They put it in your trunk. You don't even really have to talk to them. So if you do have that issue, go that way.
Is a great idea. I love that even before we were in this present situation of raising kids and having burnout from the grocery store. I absolutely love that service. I did hear that service is up, and so they're out about 5 days, so plan ahead because there has been an uptick in that service. But I love those services where people can shop for you for groceries.
Absolutely. I didn't realize they were that far out. How are you guys handling it at your practice?
Yeah, at our practice, we have had visits for urgent needs only. We are still seeing patients because even though we have this time of social distancing while we try to decrease the spread of COVID-19, people still have needs. They still might need a cut, sutured. They still have other things that happen. We are just seeing urgent needs at this time, and we are screening patients before they come into the clinic. We are a small business, and our most valuable asset is our doctor, nurse practitioners, nurses are our employees, so we need to keep them safe. So we are screening all of our patients before they come in for urgent needs. We're doing a lot of telephone visits. There's a lot of things you can move forward on the telephone, which is good communication and good conversation about problems. So we're moving that forward on the telephone. We do have telehealth and video conferencing that's available that we've been doing. And then we have text messaging and emailing as well. One thing I love about our practice is that we have a lot of modes for communication with our patients. And during this time, we are sure using all of them. So we also have our in-house pharmacy. We are doing a pickup service now, and that's to limit people coming into the clinic. So we have people call when they're there. We do curbside delivery for their medicine because we want everybody to be able to keep on schedule with their medicine and not worry about coming into a clinic and increasing exposure for others. So we're doing curbside delivery, which has been really nice. With direct primary care, having those alternate means of communication built in with our patients, it's been very helpful. I don't wish this on our patients or on us because it has been definite change and a lot of effort in planning and keeping everybody safe, but we have found some really good workarounds and look forward to those workarounds being taken away as the path gets more and more clear and COVID-19 dissipates, goes away. But in the meantime, we've had a lot of change in the office in the telemedicine, and telephone visits have really been helpful for our patients.
And I think a lot of businesses are finding that there are alternate ways to do things. I know for me, I'm doing listing appointments via Skype. My sellers send me pictures. They tell me what conditions there are. I go through numbers and everything with them via Zoom. We're still seeing each other face-to-face. But everybody, there is a workaround. It's just figuring out what it is.
Yeah, I'm sure in your business some of those workarounds can help even get things done a little bit faster instead of that drive time to meet people as well. Are you finding that?
Oh, yeah. I keep telling everybody I love it because I get more done in a day because I don't have to get all dressed up. And, I mean, I still put on makeup because I don't want to scare them. But, everybody seems to be enjoying it. They feel like, they're a little bit more comfortable. It's not so formal. And so far, everybody's really liked it. So it may be something I continue to do depending on what the seller prefers. So
yeah, that's great. I can see that in working with a realtor if I can get information via alternate communication, and then when I need to show up and look at something, do that, but move things forward and less travel time where that could be really helpful. So that makes a lot of sense.
Same thing with buyers. You can video the houses and do the same thing. And whenever it comes down to it, if it's possible, I prefer that people actually see the property because you don't want to miss anything. But still, we can safeguard and, wear gloves. If you're compromised at all, wear a mask. And that way you're safe whenever you're out and about.
Can I ask you a question?
Sure.
All right. How has this affected your business besides the reasons that you just said, a lot more alternate communication methods being used?
We haven't slowed down, so that's good. The only difference that I've really seen is I have some older sellers that have said, listen, we want you to vet everybody before they come in. So I'm having to call the agent, make sure that they're financed. We don't have any looky-loos out that we don't even know if they can get financed. Just safeguarding them to make sure they know who's coming into their house and making sure that, there's no sickness or anything like that. So that's really been it, honestly. As far as lending is concerned, we've seen a little bit of an issue. They've kind of heightened their credit scores because the banks are going to have to hold their notes because it's not great for servicers right now. And so our credit scores have gone up some. There's some that are still able to do in the 650 range. A lot of them have gone to 700. So if the bank isn't used to holding their notes, that's caused a little bit of a problem. But otherwise, all of us have found a way to do things a little bit different. Title companies are doing curbside service. Whenever possible, they're doing video, Zoom, and things like that to do closings. Notarizing, they're on the curb. So everybody's just kind of monitored and adjusted to it. So,
gosh, we're all learning a lot and being very flexible and creative and getting through this.
I think it's going to change the way a lot of people do business.
I think you're right. There's always going to be some in-office space, but alternate methods for communication have really been able to help move a lot of this forward. And just like, I think of kind of 9/11 as a benchmark for the last real national disaster that we had, and how airlines changed, screening method changed, things that were born out of that event. I think we're going to see some of these type of things that are born out of the COVID-19 event.
I agree totally. We are going to take a quick break for a word from our sponsors. We'll be right back to talk more about keeping your home and yourself safe. And we'll be talking about Oasis Family Medicine, so you know more about them. Please join us here in just a few.
Southwest Topeka has a good neighbor. State Farm agent Jim Garrison, now at 29th and Urish. If your current insurance situation has you going around in circles, get off the roundabout and stop in and meet Jim and his wonderfully efficient staff. Let Jim Garrison give you a quote and make the Garrison comparison. He's confident that with State Farm's competitive rates, the right coverage, and his unmatched service, you'll want to make him your new insurance agent. Like a good neighbor, State Farm is there, and Jim Garrison is there for you, northeast of the roundabout at 29th and Urish.
When someone has a passion for what they do, it comes through in the product they provide their customers. Just ask LaRocco's Pizza's new owner, Jason Johnson, about their crust. They make it every day and let it rise for a minimum of 24 hours before they use it for their pizza. And his staff doesn't want to do anything they won't be the best at, and you can taste it in their pizza. LaRocco's Pizza, just a half block north of the I-470 and Gage Boulevard exit. Come taste the difference.
At SportsMomsUnited.com, we celebrate every athlete and support every sports mom. SportsMomsUnited.com is on a mission to put logic back in youth sports. When you ask young athletes why they play sports, their number one answer is fun. For them, that means being on a team, making new friends, having a good time, all of which are awesome memories. We add to the memories by featuring an athlete of the day and sharing their story. Nominate an athlete today at www.sportsmomsunited.com.
Thanks for joining us again. This is Carrie Brown, Associate Broker with eXp Realty and the Preferred Advisors team, and you're listening to Real Estate 101. And I am back with Holly Cobb, Registered Nurse Practitioner at Oasis Family Medicine. And the first part of the show, we were talking about how to stay safe with COVID-19. But now we're going to talk a little bit about it's still cold and flu season, right?
It is.
So when would you know to say, okay, I think something might be wrong? What should they be looking for?
Yeah, sure. Happy to talk a little bit about that. Luckily, we're on the end of flu season, still seeing a little bit of it, and it has been a fairly aggressive flu season, and we're still on the end of cold season, so still seeing that. And we are at the beginning of allergy season, so that's another thing that can cause some cough and sniffles, too. So along with COVID-19, we have several different things going on that can cause a cough. They all have a little bit distinguishing characteristics, and if you are having trouble discerning what your symptoms are from, it would be an excellent time to pick up the phone and call your doctor, call your family nurse practitioner, and kind of go over your symptoms and get some feedback as to what a great next step would be.
So what would you say you're seeing the most of out of COVID-19?
Sure. So more than seeing upper respiratory infection symptoms, we're seeing a lot of anxiety from COVID-19. COVID-19 is out there, and we are aggressively screening for it, but also there's a lot of anxiety that is from COVID-19. So I'll circle back around to the anxiety in a minute, but as far as COVID-19 symptoms, fever over 100 is something that we are looking for, a cough and shortness of breath, and usually what we're seeing is the cough is getting worse, and that's leading to shortness of breath, and symptoms are getting worse, kind of coming in stages. Sometimes there can be some GI, that's gastrointestinal symptoms that can go along with it. Not a whole bunch of congestion with COVID-19. Runny nose is rare with it. So if you have a runny nose, we're going to put you more in the cold or allergies column, but there's not a lot of congestion with it. So they all kind of have their own subtle differences, and they are subtle differences, and so that's why if you have any question at all, then it's good to call up your family practitioner and go over your symptoms and get the next best step for screening. Another thing I want to point out, there's two terms. One is screening and one is testing. Those are both different terms. Screening is when you're being asked about your symptoms, being asked about your timeline, maybe about your travel, and if you are screened positive, that means you have been deemed at risk for COVID-19, and you're going to be tested. So the tested is where you have the actual swab, and you're getting the tested. People in the lay community, screening, testing, I hear those terms used interchangeably, understandably so. It's not their job to know them, but they are two different things. One is you're calling and you're getting screened for COVID-19 symptoms, and then the other is, you're positive for those symptoms that sound like they could be COVID-19, so now you're going to be tested. If you call and you get screened for your symptoms and you get a negative screen, what that is saying is you have been screened for your travel, your symptoms, the timeline, and this is negative. This is highly unlikely that it falls into COVID-19, and so you do not need to get tested. Does that make sense?
Right. And a lot of it sounds like you, unless it's really serious, it could be like similar to the flu. It's going to take a little bit longer to get over, and that's the reason why people are being told to self-quarantine at home. Am I right?
Yep, you're absolutely right. A lot of, most healthy people are going to tolerate this just fine. They're not going to feel well. But because the transmission rate is higher, you stay home so you don't infect people. And mostly the people we don't want to infect are people with low immune systems and people who this virus will make sick, and their life could depend on not getting the virus. So that is what the push is, to get the ventilators, the people in ICU. A large majority of those people are people who had COPD, heart disease, decreased immune systems, and are just really sick people. I think we're all hearing some stories about the exceptions, and that's another reason why we're all being careful, but the majority of the people are people who are at risk of getting the flu and of being sick anyway.
Right, and they would have been probably the ones most likely that if they were going to pass from the flu, that it wouldn't have changed much from COVID-19 to the flu necessarily, because they were already compromised as far as health is concerned.
Yeah, I hate to say that definitely, because it does seem like there are things with COVID-19 respiratory-wise that when you are sick, the way this works, you get on a ventilator and it's tough to get off a ventilator. So there are some respiratory things that are different than the flu. So the reason that it kills you are different. It's COVID-19 versus the flu. But, yeah, those are people who fall into that category that have the potential to be sick from the flu as well. The difference is, guess what? We have a flu vaccination that you can get and limit your risks. We don't have that for COVID-19. Do we want that in the future? We do, but we don't have that right now. So,
and that's why she's the doctor, folks. I would love for you to tell people about Oasis Family Medicine. When did it start? What made you guys decide to do this?
Sure, yeah. Well, thank you for asking. Love talking about our beginning story. We've been open for 5 years now. Our 5-year anniversary was March 1st. Myself and Dr. Jennifer Herder happened to be neighbors, and when I went back to school to get my family nurse practitioner degree, this was a project that I did on direct primary care. Thought it was a great idea. Dr. Herder and I were literally talking across the street about it, and kind of piqued her curiosity. Conversation continued, and literally 6 months later, we opened Oasis Family Medicine, and it has just been so much fun ever since then. The impetus for doing it was we wanted to practice. We wanted our practice to be different. How Oasis Family Medicine works is we're membership medicine, kind of like a gym. People pay a monthly membership fee, and for that fee, we provide 24/7 care. And I mean 24/7 care. Have plenty of stories that I could tell you to back that up. Some of our patients like to contact us via text, via email, and all of that is wonderful, and we are accessible and try to be there for our patients. We try to be customer service oriented. When I worked for a systems hospital, I had a receptionist and then a nurse. It was really hard to get to your provider. They were not very accessible. You had a bunch of numbers to call. You might get a call returned in a day or two. You might get a call returned in 3 or 4 days. It was not a very exciting way to practice. It was not very customer service oriented. I thought it was bottom line oriented, and it really wasn't why I went to school to be a family nurse practitioner. I went there to have relationships with patients, to serve patients, and to help keep patients healthy, and to take the very best care of them that I could. Our current healthcare system has some real barriers in being able to do that, how it's set up. It's very insurance-based. Sometimes you spend as much time checking in at the front desk, giving them your insurance card, as you do actually seeing the primary care provider. And I think that's despicable. That's what our healthcare system has become. So at our office, we take insurance out of the picture. It's the provider and the patient, and we go from there and try to give the best care and the best treatments and the best access that we can to our patients. I think there is definitely a place for insurance. One of the examples we like to give is having a high deductible, much like car insurance. In car insurance, you don't use it to fix the windshield wipers. You don't use it to rotate your tires. You don't use it to change your spark plugs. Those are built-in costs that we all know go along with owning a car. That's your primary care. There are things that you need to do to take care of the engine, so to speak, that is us. So that's what we do at Oasis Family Medicine. When there is a collision, maybe that collision is a bypass surgery. Maybe that collision is emergency appendectomy. Those emergencies are what your insurance is for. We don't want anyone to go bankrupt from healthcare expenses, and that's why we definitely want our patients to have insurance, but we can provide high-quality primary care at a reasonable price through the monthly membership fees. We also have an in-house pharmacy. Our pharmacy prices are less, and we are just really want to be customer service-oriented and take the insurance middleman out of the picture. So it's a little bit about us.
And it's all very true. It seems like in the Brown house, if something goes wrong, it's 10:30 at night, and I start my text with, "I'm so sorry to bother you, but here's a picture. What do I do?"
That is what we do. That we want to take good care of our patients, and it's great flexibility to have, because sometimes things do happen at 10:30 at night, and that's just, and who wants to have to go to the ER and pay a huge sum of money to have something that might be fine being seen the next day? Who wants to do that? Nobody wants to do that. So that's, and it does allow that flexibility. And Carrie, that is A-okay. You continue to do that.
Fortunately, they're few and far between. But we are almost out of time. So I know you guys are not really to where you can take on more patients, if I'm correct. Correct me if I'm wrong.
Yeah, no, that is right. Right now our clinic is full. We are looking to expand and get another family nurse practitioner or physician on board. We would love to take more patients, but right now, unfortunately, we cannot do that.
So let's just give them your website so that they can go out and do some research if they want to.
Absolutely. OasisFamilyMedicine.net is our website, and lots of good information there, along with all of our phone numbers, and we would be happy to answer any questions at all. And Carrie, I cannot thank you enough for having me on as your co-host today, and also for being, part of our clinic. So it's a pleasure to have you and your family.
Well, thank you so much. And thank you for hopefully being on with me for the rest of the month. We'll have more questions answered. If you're looking to buy or sell, be sure and give us a call at 785-213-5188 or check out our website at preferredadvisorsteam.com.
Thank you for listening to Real Estate 101 with the Carrie Brown team from Preferred Advisors.